Hi, and welcome to the Family Planning Talk. I am Nicole Griffith, Assistant Division Chief for the Department of Healthcare Services with the Office of Family Planning. I represent the FPACT program, which is California's innovative approach to comprehensive family planning services to eligible women and men. The objective with our time today is to provide current and prospective FPACT clients important information on family planning options, reproductive health, and options for other healthcare needs. In the next half hour, we are going to be discussing birth control options. We will touch on clients' experience within a FPACT clinic, and we will talk about how clients learned about healthcare options under Covered California. Joining us today is Patty Cason, a family nurse practitioner specializing in family planning. Alexa,
hi,
who has recently decided to use an implant for birth control. Al,
hello,
who is a half-time student and is employed part-time, has come to share his perspective on FPACT services. We also have Sandra,
hi, hello,
who is recently unemployed and just signed on to Covered California with the assistance of her FPACT provider. Thank you all for joining us today. So happy to have you.
thank you.
Let's begin our conversation with birth control. Clarifying what someone is looking for in a contraceptive method and learning about methods that are consistent with those preferences is really important. We provide our clients a means by which they can decide the number, timing, and spacing of their children. Counseling about reproductive goals, exploring a person's preferences about various types of birth control methods, and learning about methods that are consistent with a person's preferences is a large component of family planning. There are many options to choose from, and the decision process is a very personal one. Patty.
Yes.
Can you start us off today and explain the different methods of birth control options that are available?
So it's a big topic, birth control methods, and there are a wide variety of different methods. So how do you talk about them? One of the ways that we like to categorize birth control methods is based on how effectively they prevent pregnancy. So we think of things in terms of tiers or levels of effectiveness. And effectiveness is important to the majority of people who are using contraception. Not everyone, but to the majority of people. So this is a good place to start if we're looking for a characteristic about a method that's important to someone. Yeah. So the top tier, the most effective, those methods would be if 100 women use them for a year, none or one would be pregnant at the end of the year. And then there's the second tier, which if 100 women use those methods for a year, somewhere between 6 and 12 of them would be pregnant at the end of the year. And then there's the third tier, the lower tier, which is essentially everything else. So somewhere 18 out of 100 women would be pregnant, or up to even in the 20s, 25 women out of 100. So the top tier, those methods are the permanent methods like vasectomy and tubal ligation. And then there are the reversible methods, which are generally able to be used for a longer period of time if that's what the person chooses, but they don't have to be. And those would be the implant, which is the most effective method of birth control, the one that you chose, and IUDs. There's one IUD that has no hormone in it. It's copper IUD. And then there's 4 IUDs that are hormonal, and they have a varying amount of hormone in them. So if we go down to the second level, then we're thinking of things that 6 women out of 100 would be pregnant. That would be the injection. Then we've got, what's the most common type of birth control that you hear about all the time?
the pill.
The pill, which is why we don't generally ask somebody, what method are you interested in? Because they'll mostly just say the pill, because that's what they know. Mm-hmm. So a better question we have is, do you have a sense of what you're looking for, or do you have a sense of what you're interested in your method? So if you're looking at something that's about 9 women out of 100 who are going to get pregnant, that would be the pill. It would also be the patch and the ring. The pill, the patch, the ring. I think of them as sort of the same because they both have 2 types of female hormones in them. They're all very similar. One you put on your arm, one you put in your vagina, and the other one you have to take a pill every day. And then there's diaphragm and cervical cap, which are more about 12 women out of 100 would get pregnant. Then when we look at the bottom tier, the lowest level, we're thinking about things like the male and female condom, and various ways to determine what your cycle is like, and so essentially it's natural in that way. It's called fertility awareness, being aware of your fertility and making choices about sexual activity based on that. So that's one way we categorize methods. I hope that has a little bit of a stab at it.
Yes, it has. Thank you so much for sharing. I'd like to move on and talk with Alexa. How about you tell us a little bit about when you went in to see your Family PACT provider? How did you two discuss and make sure that you got the right option that was available for you?
Well, I started this conversation when I first went to see my provider, and that was actually because I had a slight little pregnancy scare. It turns out I was just late for my period, but that really got me thinking about what birth control method is right for me. I knew I wanted something effective. I wanted something that would make sure I would be covered. So I thought about the patch, but I just didn't want something outwardly on my skin. I thought about the ring, but I just didn't want to have to remember to take it out after the 3 weeks. And I even pushed towards the IUD because my sister has it and thinks it's wonderful, but I wasn't sure if that was right.
And so you recently decided on the implant, is that correct?
Yes.
And what was it about the implant that made that the right method for you?
It came down to effectiveness. It's the most effective method that's reversible. And I wanted something I could just put in my body and I make sure to kind of forget about it for 3 years because I knew I can't mess up on my side of the birth control. Since I can't remember to take vitamins every day, I didn't want to make sure I'd remember to take a pill every day.
And what is the process that you went through to get this implant?
Sure. So I went in with a clinician and they walked through the process with me. My arm was numbed, and after that they put the implant in, and it's just the size of a matchstick, and it was really quick, easy, and painless.
Doesn't seem like it hurt that much at all.
Not at all.
And what would you say to young women that are trying to find that right method for them?
I would tell everybody to just go and see their provider. I think that they really guided me towards the method that was right for me. I know the implant was good for me because I knew what I needed, but for other people it may be different. Everybody has a different body, different side effects, so the provider will best be able to guide you.
That's great. Thank you so much. And Alexa, do you have any questions for Patty here today?
Actually, I do. Since I just recently got the implant, I was wondering, are there any side effects I should be looking out for?
Well, that's a great question. The implant has one of the female hormones in it, a synthetic version of one of the female hormones in it, and it completely stops your body from putting out an egg once a month, which means your cycles are not going to be, ovulation, meaning putting out an egg, followed by a period. So you're very unlikely to get periods. You may have bleeding occasionally or spotting, but it won't be predictable. And so this is, for some women, an issue, being able to predict when they're going to know that they're going to have some bleeding. Unfortunately, about 1 in 4 women or 1 in 5 women may have frequent bleeding or prolonged bleeding. And if that were to happen to you, there are ways to manage it, so you would just go and speak to your provider about it, and you could probably get some help for that one. And it does have, as I said, it has a female hormone in it, a synthetic version, and sometimes women have, especially in the first 2 or 3 months, before their body's really adjusted. Sometimes they have side effects from that, very rarely, but it's possible. Things like acne, mood swings, hair loss, weight gain even. But it's quite uncommon, and generally people don't gain weight from it. I know people always want to know that. Generally, some women gain, some women lose, and on average, it's not at all affecting.
Everybody's different.
Right, exactly.
Well, thank you. That's some good information.
Sure.
And thank you, Patty, for sharing those side effects.
Sure.
Does anybody have any follow-up questions for Alexa?
Yeah, I have a question. Alexa, you mentioned how the implant is 3 years, but what if you want to get pregnant before 3 years is up?
Well, like I said, I'm a college student, and I know right now I don't want to get pregnant, but if that decision changes, or say I don't like the side effects, my clinician really assured me that I can always come back to the clinic and get it removed. And they also assured me that the process is really easy.
That is a super important question. You know, when we talk about methods that potentially can be in your body for a while, long-acting potentially, they can also be just as short-acting as you want them to be. So the implant, for example, it's good for up to, that up to is so important, 3 years. And if you'd like to get pregnant before that, or you'd like it out for any reason, you just go in, have it removed. And here's the best part. Your ability to get pregnant goes back to whatever is normal for you immediately. which of course is great if you're trying to get pregnant, but if you're trying to avoid pregnancy, you need to use another form of contraception immediately.
I think I'll stick with the implant for now.
Great feedback and great discussion. Thank you. Assessing men and women for eligibility for Family PAC is something providers are very familiar with. Patty, in your experience, how does this usually happen?
Well, generally the process starts at the front desk, and the front desk person asks the client questions to determine whether they would be eligible, and if it seems like they are, they'll give them the application form right then and there. They fill it out, and they are actually receiving services that day.
I agree. It's that simple. There are 4 specific eligibility requirements that go along with the Family PAC program. Number 1, the client must be a California resident. Number 2, they must meet the income requirement, which includes being at or below 200% of federal poverty guidelines. Number 3, they must have no other coverage for family planning. And number 4, they must have a medical need for family planning services.
And you know, one thing that's really confusing to a lot of providers, and I think also for a lot of patients, is this concept of confidentiality. Because it's true that for a lot of our clients, confidentiality is very important. And I don't just mean, you know, that you don't want your friend to know you're using this method, but you need to have a situation where you don't have your parents find out, or perhaps your spouse or your partner. So that's a special sort of an exception with the Family PAC program, that even if you have other family planning services for something else, you know, by some other coverage, if you need confidentiality, then you can go ahead and still get Family PAC. But the confusing thing for people is that you still need to meet all the other requirements. It's not like you can get it just because you need confidential services if you have a very high income.
Definitely some good points, and confidentiality is an important factor of family planning. And we at the Family PAC program work to accommodate this. Al, can you tell us about some of your experiences with Family PACT?
Yeah, the first time I went to the clinic was when I was 15 or 16 with my girlfriend at the time, and we were actually thinking about having sex for the first time.
Wow, that's so responsible to go in and see someone before you have sex for the first time. Don't we wish that all of our young people were doing that?
We do.
Yeah, well, we actually realized that we didn't really know anything, and so we wanted to get the right information, and they gave us condoms, so I told all my friends too, and then they went, and overall it was a really pleasant experience.
And what are some of the challenges you experienced throughout this process?
I'd say that the biggest challenge was back then I thought that I should hide this from my parents, and I was able to talk with them, and again with the confidentiality, they didn't have to release anything that I wasn't willing to release to my parents.
Seems like it all worked out for you. What were some of the successes that you had when you went through this experience?
At first, honestly, I was a little nervous because I was the only guy in there, but then I realized that they were all there just to help, and they made me feel really comfortable. They were willing to answer any questions I had, and they provided me with information about STI checking, about pregnancy scares and such. It was all really helpful.
And what would you say to young men and women who are in the same position as you and need to find out information on Family PAC services?
Find out if you qualify.
And do you have any questions for Patty today?
I do not have any questions, but I'd like to encourage everybody, men and women, to go and talk to their providers and ask any questions they may have regarding their health.
Thank you so much, Al, for sharing your experiences with us today. Many clients are surprised to learn that family planning clinics also play a key role in supporting clients' healthcare needs beyond family planning. Patty, can you share this general outline approach that is taken?
Sure. We do have one of the most comprehensive family planning programs in the country here in California. We're very fortunate. All of the birth control methods that are FDA approved are covered, and you have choice of whatever is medically appropriate for you, and also for removals, also for complications if you have any problems with them. And in addition to that, really great sexual and reproductive health services that are important, like cervical cancer screening, like sexually transmitted infection screening. If you're shown to have a sexually transmitted infection, treatment for that infection. Even urinary tract infections can be diagnosed and treated with this program. So we're really fortunate, and I feel very grateful to be living in California and working with this program.
That is great. And I would say I have to agree with you on that. Hi, Sandra.
Hi.
Tell us about your experience hearing about Covered California, the options available to you through your Family PACT provider.
Sure. So I was recently unemployed. There's a lot of embarrassment and shame that came with that. But with being unemployed also comes with uninsured. And so I had a lot of anxiety of how I was going to get my healthcare needs met. But I knew I still needed family planning services. And so one of the things was I wanted birth control, and I knew I could go to my Family PACT care provider for that. And I was surprised when I went in that my Family PACT care provider asked me how my other health needs were being met, because I hadn't thought of it. And I was honestly just hoping that I didn't get too sick where I would need to go into the ER. There was a time when I did get sick and I had the flu, and I thought it actually developed into pneumonia. Thankfully, it wasn't. But I had to go into the ER, and I was hoping to avoid that. And I knew if I had insurance, I wouldn't have to go through that. So I was surprised by the question that she gave me.
What did your Family PACT provider say to help you through this process?
She told me that I may be eligible for Covered California, and that there were other insurance options available. Let me know what those were. Told me how I could go to where I could go to apply to these programs, and also who I can get in contact with to help me apply to these programs.
And do you feel that you have a better handle on your overall health now?
Yeah, definitely. I know that I have preventative care, so I can avoid getting sick in the first place, and I know that I have a place to go to get my healthcare needs met.
Thanks for sharing, Sandra. It's
you.
great to know that all of your healthcare needs are being met and not just your family planning. Does anyone have any final comments or questions today that we should take under consideration?
Yeah, actually, I have one question. Are there any other methods of contraception for men?
That's a great question, and a very responsible question. Clearly, the Family PACT provider that you were seeing has taught you well.
Yeah.
So vasectomy is one of the most effective methods of birth control. It is considered a permanent method, so you wouldn't want to use that if you still wanted to have children in your future. It's an incredibly effective, very easy method, and it's underutilized tremendously. So I suggest that anyone who is looking for a method that's really, really effective, consider it.
A little farther down the road.
A little farther down the road.
Are there any other questions that we can take into consideration?
I have a question. So currently I'm taking the pill, but it's harder for me to remember to take the pill every day, which I think is pretty common as I ask folks around me. But it's really important that I'm able to, that I still bleed, that I still have a period. And I want to be able to make sure that I can track that. And so the pill may not be the best option for me, I'm realizing, but are there other effective methods that I can use where I can still be able to track my period?
Yeah, it sounds like it's important to you to get your period, predict that you're going to get a period, and also have something effective.
Yeah.
So we're lucky because in that top level, there's a method, which is the copper IUD, which has no hormones in it. So it has no effect on your menstrual cycle in terms of when you'll get it. You'll get your period just like you would naturally if you were not on any contraceptive hormones at all. So your period will come just like it would usually. It could potentially be heavier or longer, could be crampier. But the period can be really diminished in terms of how much blood you have if you use one of those medicines like things you would use for headache or backache or menstrual cramps, so an ibuprofen kind of a medicine, especially if you start it before your period. It cuts the amount of bleeding
All right, thank
quite
you.
a bit.
Great information. As you can see, the Family PACT program is really important. I want to thank Patty for joining us today, and Alexa, Al, and Sandra for sharing their stories with us. We have heard about their experiences with Family PACT, how they decided on birth control methods, and what it is like to sign up with Covered California to get other healthcare needs met. We hope this discussion has been valuable for you and has provided you with information that can assist with your family planning needs. We at the Office of Family Planning are committed to your reproductive health and your overall well-being. For more information on your reproductive options via Family PACT, please visit our Family PACT website at familypact.org. Thank you all for joining us today.
Thank you.
Thank you.